It's life or death for me. If I do not have it, I will not survive. It's that simple. The cancer will constrict my esophagus. I won't be able to eat. That's the end of it. Plus, it will spread. Of course, I'm scared, but I'm more scared of what happens if I don't have it than this.
A computer game prop maker, Nick Samiotis, first sought help after having difficulty swallowing. Surgeon Nicholas Penney is operating on the 54-year-old using one of the hospital's 2 new robots.
The tumour does have a few complicating factors. It's invading the left crust of the diaphragm. We've also developed some fibrosis after his chemotherapy.
In another room, Nick is being prepared for general anaesthetic.
What is it we're doing for you today?
You are, well, quite a few things, but you're going to remove my esophagus and my stomach and tie them all back up together again.
The esophagus carries food and drink from the throat to the stomach. Nick needs the cancer removed and a new food pipe made.
So we're very excited today. This is our first time using the new robots that we've had delivered. It's going to take most of the day, about 8 hours. We'll do one stage in the abdomen to start with, and then we'll be opening up the chest later.
This procedure, using a robot, is performed at only a few centres around the country. The robotic system doesn't work alone. Every movement is controlled by the surgical team.
We're able to see inside the patient in 3D. The movements that we make are miniaturized. We can move the instruments like our hands, so we've got full range of movements with the instruments rather than traditional rigid instruments.
Most of Nick's esophagus and part of his stomach is removed. The remaining stomach's repositioned and connected to the upper part of the esophagus to make a new, smaller food pouch. They use a green dye to check the blood flow of Nick's arteries to his stomach to see which areas need to be preserved. Robotic surgery means less pain for patients and smaller wounds, reducing the risk of pneumonia.
So we're just using a special staple device at the moment to make the new tube, which will become our new esophagus.
The robots, which cost more than £3 million, were paid for by the hospital charity. They're currently used in a quarter of procedures like this. That's rising to 3/4 by the end of the year. For open surgery of this kind, a patient might have to stay in hospital for up to 3 weeks. But because of the precision of this robot, that stay is reduced to just 5 days. And it makes Norwich one of the top performing trusts in the country for this type of surgery. Less than a week later, Nick's back at home.
It was daunting, mentally, I think, more than physically, because you have to get around to that. Not only is it life-changing, because obviously I don't have a stomach now, so that's the bit that I've still got to get used to. The main thing for me to realise is they've removed the cancer. That was the whole point of this. I now am, and hopefully will be, cancer-free.
I think he now is in that mindset. He wants to be fitter and stronger. So, you know, he can fight anything that does come his way now. He is going to be fine. He's a fighter. He's going to survive. And if there is another challenge, we'll just face it together.
He has to have further chemotherapy, but is grateful to the team and technology that potentially saved his life. Nikki Fox, BBC News.